In 1973, the Supreme Court made a decision that altered the direction and the destiny of the United States of America. That case that they decided was Roe versus Wade, and it opened up the doors, or rather the floodgates, for abortion to become something that was on demand in all 50 states. 50 years later, that decision was overturned by another case, Dobbs versus Jackson. This case has enabled states to be the ones to decide how they want to respond to abortion. Many states have decided that they are going to make it completely illegal. Other states are making it more accessible than ever before. But across the nation, the abortion pill is something that is trying to be pushed and made available for everybody. With me today is Dr. Ingrid Skop, and she is fighting for the life of the unborn in doctors' offices as well as in front of the courts. Ingrid, it's great to have you here on Charisma News.
Thank you, John. It's great to be with you, and it's great to be able to explain some things that a lot of people in America do not know or understand.
Yeah. So there's a lot of things that have happened recently, especially since the overturning of Roe versus Wade, and how uh, now it went from the fight being at a federal level to now it's at a more local level, and so we need people to be kind of activated in every state, in every area. And this is an opportunity for us to stand up and really help life. And you are you're a doctor. And so could you just tell us about how you are working with the pro-life movement?
Yeah, it's been a tumultuous year. It's not even been a full year since the Dobbs decision, and we've seen everything fragment. Like you said, it went from essentially Roe made abortion legalization judicial fiat. States tried to chip around the edges and pass laws, but many times those laws were not allowed to stand because of the supposed constitutionality of Roe, which of course was all a mirage. It has gone to the states. But, even at a federal level, there is a role for the legislation for legislation to be formed because right now in our country, we really have a dichotomy. We have about half of the states that have passed laws to protect unborn life. Many of those laws are being litigated because, of course, every single time it goes to the court through the court system because someone sues. But about 15 states have laws in place protecting the unborn life. So, on the other hand, about half of the states are actively promoting abortion. They're trying to get women from other states to come in and to allow abortion for any reason at any time, and even including infanticide if a baby should be born alive following a failed abortion. As an obstetrician for 30 years, like approximately 90% of obstetricians, I have never performed an elective abortion. I care for women. Of course, the unborn child is my second patient, and so
Mm,
I care for him and I advocate for him as well. But really, what has got me talking about it is seeing how many women have been harmed. Of course, the
mm,
baby is killed, but the women many times are the walking wounded. They may be emotionally harmed, sometimes physically harmed. Mental health complications are quite high after abortion. And in fact, in good quality studies from European countries, we see that a woman is 6 times as likely to commit suicide in the year following an abortion than if she had given birth to her child.
wow.
So that's what's got me involved, just having seen and cared for so many women who've been harmed by abortion.
Wow. And uh, you've had the opportunity to give testimony in front of houses of Congress and different panels, I guess. And I recently saw one of those ones that you shared in 2021. But you told about a story of somebody that you were actually caring for. Could you just kind of retell that part of that story?
Yeah, I've been fortunate that I have been able to give testimony both on the federal and state levels, and I believe that that first woman that I described was a young woman, a black woman, who her mother had coerced her into a late term abortion earlier. And when I cared for her, she was in the hospital with pregnancy complications. And at that time, she told me that if she went home, where she was living with her boyfriend, that he was also trying to coerce her into an abortion. Both of those were late abortions. So I
Mm,
would point out that the United States is quite extreme. We are one of only 7 countries in the world that will allow an abortion after the time that the baby can survive separated from his mother and for any reason. So, again, if states do not pass laws to protect unborn life, there are doctors in this country that if you pay them enough money, they will kill a baby up
mm,
until the point that that child could be born. And so this woman did not have any protection. There was no law to say it's too late, you need to carry this baby. And I think a lot of the late term abortions in our country are just that scenario. They're women who have been coerced and there has been pressure from the point that they announce their pregnancy, and finally at some point they can no longer say no, and they submit to the abortion. And it's also important to know the CDC documents that for every week further in the pregnancy, a woman is 38% more likely to die from
wow.
complications because these are very dangerous abortions. And in fact, if a woman has an abortion in the second half of pregnancy, she is 76 times as likely to die than if she'd had one in the early part of pregnancy. So, at a very minimum, we should be trying to prevent some of these very late abortions. But those who are paying attention know that our current federal government is all in on abortion. They don't want to see any limit at any time for any reason.
Right. You mentioned that the United States is on that same list of just a handful of other countries that are literally gruesome when it comes to their rights for abortion. I know of two other countries off the top of my head, and that's North Korea and China, which are both communist dictatorial countries. And so, in my opinion, that's not a list that you want to be associated with for
Yeah,
many
human
reasons.
rights violations for
Yeah, it
sure.
is a
And
human
we're
rights
right there with.
violation that people have legalized, and they're fighting for it even more. But I know one of the things that's been really encouraging are these heartbeat bills, and just how as soon as a heartbeat is able to be detected, then that life is legally identified as a viable life, and it can't be aborted at that point. And so, uh, but there's been a big fight in that, and you've been involved with some of those as well, right?
Yeah, absolutely. There's really kind of 3 levels that we're seeing across the states. Some have passed 15-week restrictions because 15 weeks is again sort of a late abortion, so it is dangerous for the mother. But in addition, that is the time that we know through modern science a baby can feel pain,
Mm,
and he's dismembered in that procedure. So dismemberment, abortion in pain-capable babies, at a minimum, our country should be allowing or restricting, I should say. The heartbeat restrictions, like you say, a heartbeat is considered a sign of life universally. So if we want to protect life, a heartbeat is a very reasonable time to protect it. And then, of course, some states, like my home state of Texas, have passed restrictions on elective abortion at any time that a pregnancy is known.
mm,
And I do want to say that every single one of these states has an exception if an abortion is needed to protect a woman's life. So we've seen a lot of misinformation, and one of the most nefarious is that doctors can't practice good medicine, that they'll be forced to choose between a baby and a woman if a truly life-threatening emergency happens. That is absolutely untrue. Every state allows a doctor to intervene. As I mentioned, I've never performed an elective abortion, but there have been times when I have needed to separate a woman from her baby
mm.
in order to protect her life. Every obstetrician will do that, and every obstetrician has the legal ability to do that, even if we're not going to take a life electively, which of course is 97% of abortions in our country,
Wow.
elective for financial and social reasons.
Wow. So you're actively involved in giving testimony with because you represent the different organizations, the Lozier I forget the name of what you said. That could you tell us about the company, the
Yeah,
organizations that you
absolutely.
work with?
So currently, I'm working for the Charlotte Lozier Institute, which is the research arm of Susan B. Anthony Pro Life America. And I am the vice president and director of medical affairs. So, as a practicing obstetrician, I've had many opportunities to shine light on the misinformation and lies, essentially, that are being spread. I also do continue to practice part time as an obstetrician in Texas. And this is after 25 years in private practice. In fact, last night I was on call, so if I look a little peaked, that might be why. But I love it.
Yeah. So if people want to find out more information about that, they can go to lozierinstitute.org, Lozier institute.org, or you can also go to www.abortiondrugfacts.com, and that'll get you back to that site as well. Because abortion drugs is something that they're trying to get this even more readily available for people, and it's a lot easier for somebody to take a pill than go to a doctor's office. So, can you talk about that and the fight for the fight against these abortion pills?
Yeah, absolutely. There's a lot to unpack there. So, and I think that many Americans know nothing about chemical abortion. It's not the same as emergency contraception. You've heard the term Plan B. This is an action that is taken after an act of unprotected intercourse that tries to prevent a pregnancy from occurring. It delays ovulation if it works right, and so there's not an egg available to be fertilized. But chemical abortion is something entirely different. It is an action performed after a pregnancy is known to exist, and the intent is to end the unborn human life. So, a totally different scenario. The FDA has approved a two-drug regimen. Mifepristone is blocks the progesterone, so it cuts off the hormonal support and kills the embryo or the fetus. It's followed generally in about 24 hours by misoprostol that essentially induces labor, so it
Hmm.
expresses the pregnancy tissue. It doesn't always work, and especially if it's done later in pregnancy, there's more tissue. So a woman may have retained tissue, she may have um, hemorrhage, infection. It's known to be associated with a very rare fatal infection. And what is happening in our country is that there is nothing mandatory about abortion reporting. So we
Hmm.
don't know the numbers, we don't know the complications, we don't know the deaths. So if it happens to come to someone's attention, it gets reported. But otherwise, there's really not a good system. So the abortion industry has spent years printing biased studies telling about the complications they know about. But at the same time, with chemical abortion, they tell women it's safer than Tylenol. This is
Hmm.
a lie, of course, but they're comparing the women or the Americans who die of Tylenol overdoses to the very few reports of deaths after chemical abortion. So it's a really invalid comparison, especially since we do not know the deaths that occur because we don't really try very hard to find them after chemical abortion. It's been a very politicized process. The FDA approved mifepristone in 2000 and broke its own rules in order to do so. They
Hmm.
defined pregnancy as a life-threatening condition, which of course it's not, but they put it into an accelerated approval category so they could get it out under the Clinton administration. They did not perform studies in pediatric population, even though they're required by the law to do that. Over the years, they've removed the safeguards.
Hmm.
They extended its use to higher gestational ages. They said, we don't want to know about a complication unless it kills a woman. They said doctors don't need to be prescribers. It can be any healthcare practitioner or nurse practitioner or physician's assistant, even though only a doctor is going to be able to do the surgery that is needed if it fails. Good quality studies, when we don't look at abortion industry studies where many women are lost to follow up, but when we look at records linkage studies where we can find all of the outcomes, we discover that about 5%, 1 out of 20 women, will have a complication requiring an emergency room visit within a month.
Wow.
Additionally, 5% of women will need surgery to remove the tissue that their body cannot express. So it's much more dangerous than it's than the American people are told. And finally, in 2021, using the COVID pandemic as an excuse, Biden's FDA removed the in-person prescribing requirements. That means
So
they
somebody
said
could do
that
this
was
via
so it
telehealth.
Right. They said it was so that it could be prescribed by telehealth because COVID was so scary that healthy women couldn't walk into a clinic. But it allows it to be ordered online and delivered through the mail without any medical supervision.
Wow.
So an ultrasound is not required, which would be helpful to know gestational age. If a woman is further along than she thinks, it's far more likely to fail. And in fact, even third trimester abortions have been documented to be given by these chemical abortion when it's just mailed through the mail, resulting in stillborn babies.
Hmm.
They're not doing an ultrasound to rule out a potentially deadly ectopic pregnancy. A woman with a pregnancy in her tube may not know it. When she experiences pain and bleeding, she may assume this is a sign the chemical abortion is working rather than a sign that her tube is rupturing and her life is in danger.
Oh
And
my
it has
goodness.
been documented that women have died from ruptured ectopic pregnancies. They're not doing labs. They're not looking to see if a woman's Rh negative and needs a ROGAM shot to prevent future
Hmm.
pregnancy complications. And equally important, nobody is verifying that the person ordering the drugs is a woman who wants an abortion. So we know
Hmm.
that sex traffickers are getting these pills,
Oh my goodness.
incestuous abusers, coercive boyfriends. We know there's already an epidemic of unwanted abortions in our country, and we know that's only going to get worse because the FDA has negligently allowed these pills to just be mailed willy nilly. I'm in Texas. We have strict laws protecting unborn life, and yet these pills are all over our state. I am still caring for women who present to my emergency room with complications from chemical abortions.
Wow.
Uh, in 2020, these accounted for over half of all abortions in our country. And there is a lawsuit right now going on. The Alliance for Hippocratic Medicine is suing the FDA, saying you are not doing your job of protecting the American public from dangerous drugs,
Hmm.
and you need to be held accountable. And we can talk about where that's going, but it's. I think the evidence is compelling in the court, and so I am optimistic that this will be reined back when the trial is finally over.
So this trial that we're talking about, is this the one that went up to the Supreme Court and then has been sent back? Uh, yes.
Yeah, it's interesting though. I think everybody who's kind of follows how judicial activism has been occurring. The It was an Amarillo court, Judge Kazmarek, and he was convinced by our arguments. He said, absolutely, it looked like this drug should have never been approved. By the way, at the time it was approved, surgical abortion was widely available, and chemical abortions have 4 times as many complications as surgical abortions. So it was approved, but it was a less effective method with higher complications. So again, it should not have been approved in the category in which it was approved. But of course, it went to the Fifth Circuit, and they looked at the evidence and said, well, it's okay that it's on the market, but we should back it up to its initial conditions of use because it was more tightly regulated when it was initially approved. It went briefly to the Supreme Court. I don't think they really had time to look at all the evidence. They sent it back to the Fifth Circuit and said, don't do anything right now, but let the trial commence. So the trial has occurred, and we're waiting to hear today on the Fifth Circuit's judgment. I have no doubt that regardless of what the Fifth Circuit says, it will go back to the Supreme Court because one side or the other is not going to be happy regardless of what happens. So the Supreme Court will get the opportunity to look at all the evidence. I think the evidence, when it's examined in its entirety, will cause the Supreme Court to put restrictions or take it off the market entirely.
And that's something that we need to be praying and interceding for, because that is something that not everybody has the experience that you have or the ability to give testimony in front of a court or in front of a judicial body, but we can all pray. We can all do something. And, we can talk to somebody that is, maybe struggling with, do I have an abortion or not? Do I take these pills? I mean, that's we can be the voice and we can be the hands and feet of Jesus, reaching out and hugging somebody that is in this situation where they feel that they have no other choice. And so, doctor, you've been able to really help a lot of people that are they're there for emergency purposes. Um, can you tell any stories? Obviously, you can't give any names for HIPAA reasons or anything like that. But could you tell any stories that you feel like this was a success? This was a life that was saved.
Well, I can tell stories like that, and I've been very active with some crisis pregnancy centers in Texas, both as medical director and as board chairman, and as a doctor on the ground. And it is the case, like you mentioned, we need to be praying. That is first and foremost. We need to educate ourselves, but we also need to be aware that in our communities, there are organizations that are working to intervene, to intercept women in crisis. In our country, there are 2,700 crisis pregnancy centers and some compelling data from these centers. Most of the women who present to these centers say that they want to carry their baby, but they need help. They need emotional support, perhaps financial or material support, relationship support. About 70% of women say they would carry if the father of the baby was willing to support them. So I think that we see that so many women default to abortion just because they don't think they have any other options. And again, going back to the getting these pills over the internet, they're never going to be told that there's another option. So supporting these local pregnancy centers, making sure that we're getting the information out to women that there are resources available is absolutely critical. But I have, through those centers, I've seen so many women who have chosen to give birth to their children, and it's been a beautiful thing. On the other side, I want to tell us another story about chemical abortion, just so that people will understand how this looks. So again, these women are the pregnant, or the abortion industry is actually pushing them toward chemical abortion. In many cases, they're not even telling them that there's a surgical option, which, as I mentioned, is safer. And of course, they're not telling them there's options where the states will give material support to help them bear their children. But the average woman will bleed for at least 2 weeks. Recently, I cared for a woman who bled every day for 2 months. That's what the bleeding looks like. 40% of the women describe the pain as severe. Again, their body is going into labor to get rid of this tissue. And at 10 weeks, this is kind of graphic, but people need to be aware of this. The baby is about the size and shape of a gummy bear. He's clearly identifiable as a human being. And many women are seeing that child in the toilet. So, this is the emotional cost of women who are going through these chemical abortions. More than half of all abortions in 2020, 500,000 abortions. There's no lower age limit. Again, this could be a 12-year-old victim of incest, alone, going through this experience, seeing her child. So it is tragic. The woman that I mentioned that bled for 2 months had been in and out of emergency rooms. Nobody recognized what she needed was surgery to remove that tissue. So I was able to care for her. The other question that your listeners may have is, if this is happening at such a scale, why aren't we hearing about it? Well, I think they all recognize the mainstream media is very pro abortion. They're not going to tell us. But these women are ashamed, and they remain silent. When I've asked them, do you want to report this complication? They say, no, I just want this experience over. And many of them tell me, I think this is maybe what I deserved for making this choice. So they're suffering in silence. Their hearts are broken. These crisis pregnancy centers many times do offer post-abortion counseling programs, which are very, very impactful. But the sad thing is that the American church, from the pulpit, rarely addresses this issue, even though 1 out of 4 American women, 1 out of 5 American men have been the parent of an aborted child. Those people are sitting in the pews, and they're hurting. and we're ignoring it, unfortunately, as a church, which is heartbreaking. But hopefully we'll stop doing that and start talking about it.
Amen. Amen. Well, thank you so much for talking about this and standing up and not just saying something about it, but saying it to the right people and being able to go before the courts and go before the judicial bodies to be able to give expert testimony with this. And thank you so much for sharing a bit of your expert testimony with us today. Man, some of the things that you shared are just heart wrenching. Seeing the whole thing of seeing the gummy bear sized child um, that they've just aborted, that breaks my heart. My goodness. And so, um, could you just tell people how they can get a hold of you, how they can find out more information?
Thank you, John, for this opportunity. Yeah, so again, we need to be educated, and it's hard to find good data. The Charlotte Lozier Institute, our mission is science and statistics for life. The good news is science backs up a pro life position from the get go. That's a very complex, genetically distinct individual human. Lozierinstitute.org is our main website. Abortiondrugfacts.com is a portion of our website dedicated specifically to chemical abortion. I would also mention the American Association of Pro Life Obstetricians and Gynecologists, AAPLOG.org, has a lot of good information. And you don't have to be a doctor to read this. I mean, it's created by doctors, but everything that is on all of those websites is extensively referenced from the peer reviewed literature. So, this is not our personal preference. This is what science says. And so you need to read, you need to educate yourselves, you need to tell your friends so that they're educated, because that's the only way we're going to turn the tide, is for people to realize what is happening.
Amen. Amen. Dr. Ingrid Skop, thank you so much for being here on Charisma News. God bless you.